Bismillahirrahmanirrahim. Hope, Health Oriented Preventive Education, is a charitable organization based in Karachi, Pakistan. Hope is basically an NGO working towards community development, and it comprises of basically doctors, educationists, social workers, as well as grassroots workers. In Hope, our target population comprises of women and children, and our vision is to develop a well-educated, healthy society in which women and children have equal rights. We work mainly in the urban slums of Karachi, each urban slum comprising of a population of 60 to 80,000. Many rural villages in interior Sindh, Thatta, as well as in the northern areas. We are working in Azad Jammu and Kashmir, NWFP, as well as within interior Sindh we have a large project in Dadu. As you can see, these are some of the urban slum areas where basic facilities are lacking, and these are the children who are playing on the streets, sitting on the garbage dumps and eating the food. There are many areas in rural Sindh as well as rural Balochistan where it's not just the quality of water but the quantity of water, and Hope installs hand pumps in these areas to provide for the water. These are some of the sites of the rural areas where you can see animals live side by side with the children. One of the main areas in which Hope is working is education, and we have two systems of education. One is a formal system. There are two formal schools of Hope, one based in Karachi, in which 450 children study, both boys and girls. This is right up to metric, and it is got science laboratory as well as a computer lab. We have another school in Thatta in which 200 children study. In Thatta, most of the children are very poor. They work in the fields as well as study. This school is right up to class 8. Another system of education that we have is an informal system of education. Through the informal system of education, we have 192 home schools in which 9,000 children are provided primary education, and this is spread all over Karachi, interior Sindh, as well as the northern areas. As you can see, in the home schools, the children sit on the floor, provide a dari for them. There are 35 to 40 children studying in these home schools. Textbooks are provided free of cost, as well as blackboards, stationery, registers, etc. And the girl or the teacher is provided a stipend. She teaches the children. It becomes a source of earning for the women as well as education for these children who would otherwise play on the streets. Some of these are sites of rural areas. Another aspect in which Hope works is girls' education. In Pakistan, girls drop out of school after class 5 because the secondary school is generally far off from their homes. Hence, you can see that in many of these areas, older women are provided education. The second most important aspect in which Hope works is health, and Hope has two hospitals, one based in Karachi and one based in Thatta. The two hospitals were provided through the Embassy of Japan through the Grassroots Assistance Program, and these are some of the photographs of the signing ceremony as well as the inauguration. The hospitals are 20-bedded hospitals with a fully equipped operation theatre, incubators, X-ray, laboratories, and intensive care for patients, basically mothers as well as children, as well as adults. There is a well-equipped laboratory as well as a medical store. The hospital in Thatta is slightly bigger in area because it is a rural areas. Most of the patients in Thatta are very poor, as Thatta lacks in basic health facilities. Hence, patients otherwise needed to be transferred to Karachi are now treated in Hope Hospital, Thatta. Hope also has a community development program, and through this community development program, many villages are covered. The third aspect in which Hope works is vocational training. That is, skills are provided to these youth of the community. One of them is the traditional skills of embroidery, sewing and cutting. One of the slides is of Thatta, and the other is basically computer skills, as we believe that the youth should get accustomed to computer skills. We have 5 computer centers based in Karachi, Thatta as well as Muzaffarabad. In addition to computer, English language is also taught to these youth so that they can progress further in the world. We also have many maternal and child health centers. These are basically satellite clinics in which primary healthcare facilities comprising of immunization, growth monitoring, nutrition advice and family planning is provided. Another aspect in which Hope works is polio rehabilitation, and not only just polio rehabilitation but rehabilitation of cerebral palsy or physical disabilities. The fourth aspect in which Hope works is relief activities, and since the past 4 or 5 years, relief activities has been a very important role of Hope because of so many emergencies. In 2005, when the earthquake struck the northern areas, a 17-member Hope team visited these areas and provided facilities, medical care, medical camps. However, unlike other NGOs which left, Hope continued working, and it is still providing rehabilitation services in the northern areas. And as you can see, in the northern areas there are many structures which have come up, and Hope is helping in providing health care in Bagh as well as Muzaffarabad district. In 2007, the floods affected Sindh and Balochistan, and many villages were wiped out. Hope has started a program of nutrition rehabilitation with mobile teams as well as medical relief and emergency relief in many of these areas, distributed blankets, clothes, tents, etc. In addition, Hope is also looking after a 10-bedded ward in Civil Hospital Dadu for children with malnutrition and with complications. Very recently in 2008, another earthquake struck Balochistan, and the Hope was one of the very few NGOs to reach there and provide medical relief as well as tents, food rations, blankets in the cold, and nearly 6,000 persons were provided services by a 20-member Hope team. Thus, there are 4 aspects in which Hope is working: education, health, vocational training, and relief activities. You can also join hands with Hope. You can help make a difference, and your contribution can help educate a child, help make a family healthy, and the amount varies from a minimal $40 to $450. The address of Hope USA is given over here. Hope USA is an IRS registered 501c3 charity. The account number and the routing number is given over here with the details of the contact address. Please do consider Hope as an option whenever you would like to make a contribution to help the suffering humanity. Thank you very much.